Hey, it's Caden. It is March 16th, 2010 at 12:30 this afternoon, something like that. So it makes it pretty much exactly 24 hours post-op. I would have been just getting done, um, or in recovery or something. I don't really remember, but close to it. Everything's been going well. I figured I'd talk through kind of the day yesterday before I forget about it. Just to let you guys know. So, well, now that I'm a little more coherent. So I left about 7 o'clock in the morning to go to the hospital. Got there about 7:30 and got checked in. They brought me up to where I was going to check in, brought me to my room. The nurse had me get weighed. I don't remember what else. No, there's something else. Oh, she took my temperature, blood pressure, pulse, that kind of stuff. And then another nurse came in to give me my cute little gown and robe and socks and hair thing, whatever that thing's called. So I did that, and then I also had to pee in a cup, like I mentioned in another video, to prove that I wasn't pregnant. Which is fine, otherwise I would have had to sign a waiver, but whatever. The nurse was really funny because she's like, I'm so embarrassed about having to ask this and blah blah blah, because I'm sitting there with my wife, so it's not like I would be pregnant, but it was cute. And then another lady came in and I paid the hospital fee, gave her my driver's license, she went and copied it, all that good stuff. Then another lady came in who was my nurse, which was super nice. She was using female pronouns, but I didn't correct her, and I didn't really care, and then I don't care at all. And then afterwards, she, kind of in between towards the end, she asked what I prefer to go by. I told her, but it really doesn't matter to me. Then that lady gave me my IV. She asked me a whole bunch of other questions, too, like medical history and I don't remember, all that stuff you have to go through. She gave me my IV, she numbed it. She didn't really wait for it to kick in, the numbing thing. She just numbed it and then stuck it in, but it wasn't too bad. Just took the Band-Aid off, and it's a little painful and bruised there. Then there was just lots of nurses coming in and out, like once in a while. Oh, the anesthesiologist, he came in and talked to me and went over my history of motion sickness, and I have fake teeth. They don't come out, but they need to know that, and TMJ and that kind of stuff. And he just went through everything. He's a really nice guy, and there's so much stuff going on, just in and out, different people doing stuff, whatever. Then the doctor came in. He was late, which is fine, but he was pretty funny. I had to run back at the camera so he could take pictures of me. Then he drew everything out. You can still see some of the lines, I'm sure. I drew everything out, got ready. I went to the bathroom right before I went in, so I wouldn't have to get a catheter, because he said it was a short enough surgery. I don't know. It was supposed to take 2.5 hours, but it didn't. Probably took about 2, but I'll ask him today. I'm going to see him in a couple hours. So he drew on me. I went to the bathroom, then they wheeled me down and said goodbye, and next thing I knew, I was waking up in the bed. Well, they brought me into the surgery room and got me all set up, warm blankets, little thing on your legs that make the blood go around. I have my arms out. I can't do it right now, but I have my arms out to the sides. They had blankets and stuff all over them. Put some monitors on me. Then we were kind of joking around, but then they told me to, think of a good spot, think of a place to be, so I did, and that's all I remember. I don't even, the doctor was not even in there, so I don't know when he came in, but I was out. Then when I woke up, I was just in the bed, recovery, and they were really nice. Eventually wheeled me down the hallway, somewhere anyway, and I got an English muffin and some jam, so that was good, and some apple juice, which was great. My last surgery just got saltine crackers, which are like gross paste. I'm making a video, so don't come out naked. Jeez. I'm not.
figured that out, thank you.
Okay. She's in the bathroom. I'll be done in a second. Let's see. Then Megan came back, and I was just eating. They gave me pins so I could pin this up. Gave me some other Ace bandages. They're just still monitoring my vitals. Finally, they took my IV out, and they said I could take the Band-Aid off and wash it off the next day. So I just did that, and it's really sore when you touch it. And then eventually we got dressed, and Megan drove me back, and I took some pain meds right when I got here because it was pretty painful. Actually, like right here, I don't know if that's where this drain is ending on the left side. It's been draining a lot more on the left side, which is this one. And that was also my bigger boob, and since I'm right-handed, I think that makes a difference too. But I don't know. What else? So took some pain meds, some Tylenol, extra strength to help with the swelling. I think I ate something. I don't know. I really don't remember. Tried to take a little nap. I cannot sleep on my back. And then kind of played on Facebook for a while. To sleep on my back, I have to prop pillow up a little behind me. And this bed's so uncomfortable that I have like one under my butt, under my leg, so my lower back doesn't hurt. But the pain's been pretty good. I wasn't able to like sit up by myself or lay down without being really painful. So Megan helped me with that. But now I can do it just using my abs. It still hurts, but not too much. So that's about it. I'm going to see the doctor this afternoon at 2:30, so we can check things out. So maybe I'll get to see it then, and maybe I can post some pictures, let you guys know. But pain hasn't been that bad, but I have been taking painkillers. Otherwise, yeah, it hurts a lot. So I didn't want to do it. I'm definitely along the incisions, like where it feels like the drain come out, especially on the left side, and the right side sometimes. And what sort of feels like my nipple, so that could be a good sign. But that's about it. I'm going to let her come out of the bathroom now so she can get dressed and we can go to the doctor. So I'll talk to you guys later. Bye.